Welcome all to India Valves 2017. We're here in Delhi.
Welcome dignitaries, welcome to the chairpersons and the expert panelists.
Very good morning to all of you, and in the next 2 days we are going to really learn from one of the world's biggest experts who are here.
As we all know, CT scans have now become the gold standard for imaging for TAVR.
We are going to Vedanta Medicity for the live case, and there will be a presentation by Dr. Grube.
And then they are constrained into the non-flareable end of the outer sheath.
Quite a few of these patients also have diastolic dysfunction, a stiff left ventricle, and is dependent on preload and will need volume, particularly if they have some kind of bleeding during the procedure.
Because sometimes in very frail and very elderly patients, by just fixing those arteries, they suddenly become quite asymptomatic and are able to continue the quality of life.
Thank you.
I am Dr. Geeta Subramaniam, Professor HOD Cardiology, Institute of Medical Sciences, Banaras Hindu University. I want to be always a very cool cardiologist because after all,
I think this is a great forum. I think this is important. There's been a lot of mistakes made with the adoption of this therapy, and we want to try and avoid replicating those mistakes. This is not the same as normal procedures that interventional cardiologists do. It's important to educate the community about the risks, the potential, the benefits of this therapy, but also the sort of watch-outs and cautions.
For me, coming here is it's incredibly important because what I see here now, even though the TAVR field in India is still fairly young, we can see a lot of interest. The room is packed. People don't leave. They interact beautifully with the presenters. And I think that's the forum. You can see the interest in the community rising, and that's very good that you catch that at the very beginning to get it into the right direction. As Sushil said, not to make the same mistakes that we did in the beginning, replicating this. I'm impressed by the audience. I'm impressed by the speakers. Very disciplined, very interactive, and very, very practical and interesting.
India Valves is an organization which is trying to bring this new technology of treating heart valve diseases, which was not being treated earlier because many patients could not undergo a valve surgery because either they were too weak, they were quite aged, or maybe the body was not fit enough to undergo a surgery.
But Dr. Praveen Chandra alluded to, it is basically changing heart valves without conventional open surgery. That is what transcatheter valve therapy is all about.